There is so much talk lately about hormone health, but what does that really mean? How do we know our hormones are in an ideal spot? Well, here to sort it all out is Dr. Priya Patel, who is the founder of Feminology MD. Now, she is a double certified doctor, so OBGYN. She's also certified through the American Board of Anti-Aging and Regenerative Medicine. She has a lot of accolades, but most of all, we want to find out what are hormones? What does this really mean when we're referencing hormones?
Well, that's a very complicated answer, but you know,
give us a simple one.
A quick version is basically think of hormones as chemical signals.
Okay.
So they're basically signaling molecules that allow different parts of the body to communicate.
Okay.
And we actually have lots of different hormones in our bodies that do a myriad of different things. But oftentimes when we think about hormones, you know, as a female, we tend to think about reproductive hormones and hormones that affect menopause and things like that. But we actually have hundreds upon hundreds of different hormones in the body in general.
Let's run through some of the stages of life, right? Because you were saying, okay, they first become important really in your teen years. What are we dealing with there?
Yeah, so, you know, in general, when we say like puberty and, you know, menarche, which is basically the first time a girl has a menstrual cycle, is basically when those hormones sort of become reactivated. And so once the signaling cascade sort of starts, the brain gets activated, it goes to the ovaries, and then stimulates the ovaries to produce these different hormones that we typically think of, like estrogen and progesterone and all those different hormones, even testosterone in, you know, lower doses. And those hormones are sort of what cause our reproductive system to start working. And so in our teen years, a lot of times, you know, when a female initially has her first menstrual cycle, a lot of times the first few years after that are a little bit rocky, right? A lot of times you hear about irregular cycles, or they're having really bad PMS symptoms, things like that. It's because that signaling cascade is really immature. And so basically when the brain is going to the ovaries, you know, it's not quite a well-oiled machine yet. And so there can be a few years in there when things are a little bit rough. And then ideally, after a few years, we hope that you know, signaling cascade tends to normalize and get into a better pattern.
Okay, so I guess the question here is, because then there's the phase of 20s to 30s, reproductive years, then there's perimenopause, menopause, et cetera, et cetera. But the big question is here, how do we know if our hormones are off, and who do we seek out if we think they might be? Yeah,
no, absolutely. So, you know, in terms of off, I usually tend to think of symptoms, right? If you're having irregular cycles, if you're feeling fatigued, your sometimes if sex drive's not great, you're not sleeping well, you're gaining weight, a lot of those different things are affected by hormones.
What type of doctor should one go to if they're curious, if they need to get these checked?
So typically, you know, I would say from a woman's standpoint, usually an OBGYN is kind of probably going to be your physician that's most well-versed in hormone management. Sometimes your primary care or family practice doctor, you know, has a general idea, but probably an OBGYN, that's kind of their niche and wheelhouse.
And then do we say to him or her, hey, I want this tested, or should they know? Do we just give a general, like, hey, test my hormones, doc?
I think you start with the symptoms, right? I think the most important is to say, hey, you know, make a list really, you know, before you even walk in for that visit. A lot of times time is short, right? So really, you know, sit down with yourself at home and make a list of the things that are affecting you. And then when you walk in and you have that visit, you know, you actually pull out your notes and say, these are the 6 symptoms that I'm having. And then really their job, right, is to then take those symptoms and figure out what workup needs to be done and sort of how to get solutions.
And we just got like 30 seconds here, but what types of solutions are there?
So, you know, there's hormone replacement therapy. Sometimes there can be sometimes we have to use different things to regulate cycles, different medications. Sometimes it's supplements. Sometimes weight loss can be a component of things. But there's lots of different treatments to sort of help solve whatever the symptoms might be.
Okay, but we show up with our list, and I know that your business model is based on having a little bit of a longer visit to be able to talk about it more. Thank you so much, Dr. Patel.
Absolutely. Thank you for having me.
I wish my in-studio visit was longer because I have more questions, but we'll have to have you back. Thank you so much for the time. So again, she is with Feminology MD. We will link it on our website, cw33.com.